National Family Planning Program, right? And nowadays we are going towards शेर का बच्चा एक ही अच्छा, ठीक है? So these things are to be followed for population control under this National Family Planning Program, and this national, I hope थोड़ा बहुत silence मिलेगा मुझे. Yeah, National Family Planning Program comes under the parent program known as RCH, that is Reproductive Child and Reproductive Child Health Program. Okay, so under this RCH program, we have this National Family Planning Program of India. If I talk about the eligible couple, which is defined under this program, what do we mean by an eligible couple? A couple who is married and whose wife is between 15 to 49 years of age group. 15 to 49 years of age group. That is what is your reproductive age group. What is the reproductive age group? 15 to 49 years. What is the reproductive age group? 15 to 49 years. Okay. So a couple who is married and whose wife is between the 59 to 49 years of age group is considered as which couple? It is considered as an eligible couple. So eligible couple means the couple who is eligible for practicing contraception. Okay? That is what is an eligible couple. So what is the difference between eligible couple and a target couple? Anybody? What is the difference between an eligible couple and a target couple? So the target couple is the one who is currently not using any type of contraceptive and who should be targeted under this NFPP program for use of contraception with counseling methods or etc. Okay, by distribution of contraception. That is what is a target couple. What do we mean by CPR? CPR means the couple protection rate. It is the couple protection rate. That means it is the total number of protected couples. It is the total number of protected couples. That means the couples using contraception upon the total eligible couples. Upon the total eligible couples into what is the multiplier? The multiplier is 100. So here A is a part of B. Numerator is a part of denominator and multiplier is 100. Therefore, it would be expressed as. Therefore, it would be expressed in percentage, and therefore it is a proportion. Therefore, it is a proportion. So A is a part of B and multiplier is 100. It would be expressed in percentage and it would be called as a proportion. If A is a part of B and multiplier can be 1000, 10,000, 1 lakh, then it is a rate. A is a part of B, multiplier is 1000, 10,000, 1 lakh, then it is a rate. And if A is not a part of B, then it is a ratio. A is not a part of B, it is a ratio. No issues with this? So coming back to couple protection rate, it is the number of protected couples or couples using contraception upon the total eligible couples into 100. The current couple protection rate of India is? So the current couple protection rate of India is? उनका देख के आंसर क्यों बदल रहे हो? So it is like currently most of the census says it is 54%, but the recent data says it is 55%. So it is around 54 to 55%. But our target under National Family Planning Program is to achieve a CPR of more than 60%. So our goal is to achieve a CPR of more than 60%. That means out of 100 couples, at least more than 60 couples should use contraception. And if CPR of more than 60% is achieved, that means we will be able to achieve our target, that is NRR, net reproduction rate of 1. Okay, if CPR is more than 60, then NRR will become 1. If CPR is more than 60, then NRR will become 1. And what is you are saying is 2.1, it is TFR. Total fertility rate will be achieved as 2.1. I'll discuss that. At least ये इतना यहाँ पे याद रखो, ठीक है? Current CPR is? Current CPR is? CPR का target or goal is? And NRR would be 1 therefore. Then if I talk about contraceptive failure, which is the best indicator of contraceptive failure, anybody? Best indicator, shabash. It is the life table analysis. It is the life table analysis followed by Perl index. So what is the best indicator of contraceptive failure? live table analysis. What is the best indicator of contraceptive failure? Live table analysis. Okay, important. If I talk about Perl index, guys, it is most commonly used. Okay, and Perl index ka formula is number of accidental pregnancies upon total months of exposure into multiplier is 1200. Multiplier is 1200. So please remember, for Perl index the multiplier is Perl index the multiplier is 1200. For Perl index the multiplier is don't forget it. It was asked multiplier of Perl index kya hai, and that was 1200. Most of us marked it as 100,000, 10,000. Okay, it is not 100,000, 10,000. It is 1200. So it is number of accidental pregnancy. That means the pregnancies which occurred even on using contraception upon the total months of exposure into 1200. That is what is your Perl index. And Perl index is expressed as per 100 women years. Okay, Perl index is mentioned expressed as per 100 women years. ठीक है, तो यूनिट भी पूछे जाते हैं. Don't. Okay. Then next, if I talk about contraceptions now individually. So the first that you can see is a male condom. The first you can see is a male condom. Okay. So male condom usually has a single ring. It is shorter in length and it is made up of which material? It is made up of latex. Therefore, there can be chances of allergies also. Okay. It is made up of latex. And is it reusable or non-reusable? It is non-reusable. And what is the Perl index of male condom? The Perl index of male condom is 2 to 14 per 100 women years. What is the Perl index of male condom? Perl index of male condoms? Perl index of male condoms? If you need to answer one, 14 per 100 women years. If you need to answer one, 14 per 100 women years. Then if I talk about the next image that you have, this is actually a female condom. This is actually a female condom. So how to differentiate? Please remember, female condom is usually longer. Second, it has how many rings in it? It has usually 2 rings in it. Okay? And it has usually how many rings in it? 2 rings in it. Okay? It is longer and it is reusable. It is reusable. Okay? And it should be inserted 2 hours prior to the intercourse and removed 2 hours after the intercourse. So it is inserted 2 hours prior to the intercourse and removed 2 hours after the intercourse. No issues with this. What is the Perl index of female condoms? 5 to 21 per 100 women years. What is the Perl index of female condoms? What is the Perl index of female condoms? Silica nahi, silica is a metal. Polyurethane hota hai, okay? It is made up of polyurethane. Perl index is 5 to 21 per 100 women years. No issues with this. If you need to mark one, it is 21 per 100 women years. Next, if I talk about this one, what is this contraceptive known as? This is known as a vaginal sponge. This is a vaginal sponge. And vaginal sponge is famous by the brand name Today. Vaginal sponge is famous by the brand name Today. It is famous by the brand name Today. Important about vaginal sponge. It should be inserted 4 hours prior to the intercourse and removed 4 hours after the intercourse. Female condoms, how many hours prior? And how many hours afterwards? Vaginal sponge, how many hours prior? How many hours afterwards? If vaginal sponge is retained inside, okay, it can lead to toxic shock syndrome. So please remember, if vaginal sponge is not removed for a period of more than 6 hours, then it can cause an important side effect and it can lead to toxic shock syndrome. It can lead to toxic shock syndrome. What is the Perl index of vaginal sponge? It is 9 to 20 per 100 women years. What is the Perl index of vaginal sponge? What is the Perl index of vaginal sponge? What is the Perl index of vaginal sponge? 2 to 14, 5 to 21, 9 to 20. Famous by the brand name. If kept for more than 6 hours, it causes Shabash. Then this one, this contraceptive which is present in this pink color box, it is known as vaginal. So this is a vaginal, and vaginal diaphragm should be inserted how many hours prior? It should be inserted 6 hours prior and kept 6 hours afterwards. It should be inserted 6 hours prior and it should be kept for 6 hours post intercourse. No issues with this. So this is vaginal diaphragm. Again, it is a reusable contraceptive. It is also a reusable contraceptive. No issues with this. Then if I talk about this one, these tablets are available under our National Family Planning Program. These are the Centroman tablets. These are which tablets? Centroman tablets. And Centroman are hormonal contraceptives or non-hormonal contraceptives? So these are the only non-hormonal contraceptives. These are the only non-hormonal contraceptives. They contain estrogen, but these are considered to be non-hormonal contraceptives. No issues with this. Previously, Centroman was famous by the brand name Saheli. Previously, they were famous by the brand name. Now they are relaunched in the market by the brand name Chaya. Previous name was? New name is? These are which tablets? Non-hormonal. And these are Centroman tablets. The chemical which is present in Centroman tablets is? These are usually non-hormonal, non-steroidal. Non-steroidal. It is ormiloxafen. And ormiloxafen is a what? It is a selective estrogen receptor modulator. So non-steroidal contraceptive known as Centroman tablets, previously by the brand name Saheli, now by the brand name Chaya. It contains which chemical? Ormiloxafen. It contains which chemical? Ormiloxafen. And ormiloxafen is a SERM, selective estrogen receptor modulator. No issues with this, anybody? Next, if I talk about a long-acting contraceptive, long-acting contraceptives are called as depot contraceptives. So they are famous by the brand name Antra. So the only long-acting or depot contraceptive used in Indian family planning program is Antra. And Antra contains DMPA. Depot medroxyprogesterone acetate. What does DMPA mean? Depot medroxyprogesterone acetate. And depot means it is a longer acting contraceptive. It is given once every 3 months. This was a question. So Antra or injection DMPA. So it is an injectable contraceptive and it is given once every 3 months. No issues with this, anybody? I hope so. Then if I talk about these ones, the commonly used ones, these are known as COCPs, that is combined oral contraceptive pills. Why combined? Because they contain estrogen as well as progesterone. So they contain estrogen in the form of ethinyl estradiol. And they contain progesterone in the form of levonorgestrel. So what is the dose of ethinyl estradiol? 30 micrograms per tablet. What is the dose of ethinyl estradiol? What is the dose of levonorgestrel? 150 micrograms per tablet. What is the dose of levonorgestrel? Dose of ethinyl estradiol? 30 micrograms is ethinyl estradiol. And 150 micrograms is levonorgestrel. No issues with this. So we have two of them. Either it is Mala N or Mala D. Mala N is given free of cost and Mala D packet costs ₹3. No issues with this. Now you can see that almost 3 lines are similar. That means 21 tablets are similar and these 21 tablets are COCPs. But the last 7 tablets are different in color. So these last 7 tablets are iron tablets, ferrous fumarate tablets. These are ferrous fumarate tablets, right? And these ferrous fumarate tablets are given for what reason? This was a question. So first of all, these ferrous fumarate tablets help in withdrawal bleeding. ठीक है. So after 21 days, if the COCPs are stopped, the patient will have withdrawal bleeding. Second, they also help in preventing anemia. They also help in preventing anemia in the patient, and they also help in maintaining continuation of the cycle. They also help in maintaining continuation of the cycle. So important तीन चीजें पता चल गई. Why are iron tablets added in COCP regime? So important. Please tell me. First of all, they will prevent anemia. First of all, they will prevent. First of all, they will prevent. They will cause withdrawal bleeding. They will lead to withdrawal. So iron does not cause withdrawal bleeding. It is due to withdrawal of stoppage of COCPs which causes withdrawal bleeding. Okay. Iron is just given for continuation of menstrual cycle. And important, lastly, iron will also cause continuation of the menstrual cycle. Okay, no issues with this, anybody? And these are ferrous fumarate tablets. These are ferrous fumarate tablets. No issues with this, anybody? Now, please tell me, COCPs are definitely used as contraception. So, what is the Perl index? Perl index of COCPs is 0.12, 2 per 100 women years. What is the Perl index of COCP? What is the Perl index of COCP? What is the Perl index of COCP? 0.12, 2 per 100 women years. Now, COCPs are not only used for contraception, they are also used for emergency contraception. And what do we mean by emergency contraception? After sexual intercourse. So, emergency contraception is also known as post-coital contraception or interception. It is also known as interception. So COCPs can also be used for interception. And COCPs, if they are used for interception, it is used by which regime? Anybody? Very good. They are used by the USP and Lancer regime. They are used by the USP and Lancer regime. So for interception, COCPs are used by which regime? For interception, COCPs are used by which regime? USP and Lancer regime says 4 pills should be given, then there should be a gap of 12 hours, and then again 4 pills should be given to the patient, right? Within a period of 72 hours. Okay? No issues with this. So please remember, for interception, COCPs are given by which regime? USP and Lancer regime. How many pills are given? 4 pills with a gap of 12 hours. And again 4 pills. So total pills given are 8 pills. Total pills given are 8 pills within a period of. Whereas for interception, we definitely can use COCPs, but the drug of choice for interception are. Very good. The drug of choice for interception are. Levonorgestrel pills. Drug of choice for interception are. Levonorgestrel, that is your progesterone only pills. These are known as progesterone only pills, also known as mini pills or lactational pills, and they contain only progesterone, that is levonorgestrel, and the amount of progesterone which is present, it is 0.75 mg. It is 0.75 mg. How are they given? These are unwanted 72 tablets jo hote hai na. These are to be given within a period of 72 hours. Okay, and they are given as 1 pill with a gap of 12 hours, and again 1 pill. Okay, so how many pills are given for LNG? How many pills of LNG? Total doses 1.5 mg. Total doses 1.5 mg. No issues with this. So drug of choice for interception are LNG pills. If I ask you the most effective method for interception, the answer would be most effective method of contraception. Most effective method of interception or emergency contraception is IUCDs, right? IUCDs. Why IUCDs? Because they can be effective up till. Whereas all others methods of interception are effective until 72 hours. So whether they are COCPs or whether they are LNG pills, they should be given within a period of 72 hours. But अगर खुदा ना खास्ता तुम भूल जाते हो 3 दिन, फिर तुम्हें चौथे दिन तुम्हारी नींद खुलती है, अरे कुछ तो हुआ था, then you will give IUCD for that patient. ठीक है? So IUCDs are maximum effective up till 5 days. One more method which is effective up till 5 days for interception is ulipristal acetate. It is ulipristal acetate, also known as ALA. also known as LR. ठीक है? But the most effective still remains IUCD. Most effective still remains IUCD. अगर वो patient for example unmarried है, ठीक है? So then you will prefer ulipristal acetate. Otherwise you can give IUCD to the patient if she is married. ठीक है? No issues with this. So most effective method of interception, but the drug of choice for interception, LNG pills. No issues. Then if I talk about IUCDs, we have the first generation IUCDs, and these first generation IUCDs were made up of silastic or plastic, and this one is known as the Lippes loop. This one is known as the Lippes loop. But Lippes loop had high failure rates, and therefore we came up with a bioactive IUCD, which is a second generation IUCD. So this second generation bioactive IUCD is usually impregnated by metal. It is usually covered with metal, and the most common metal used is copper. The most common metal used is copper. So these are known as copper T because they are T-like in shape. Therefore, they are known as copper T. So they can be copper T 220. They can be copper T7, or most commonly used IUCD nowadays is copper T 380A. The most common IUCD used in Indian program is most common IUCD used in Indian program is ठीक है, copper T 380A. Most of the copper Ts have a half-life of around 3.5 to 5 years, but copper T 380A has a shelf life of 10 years. Okay, copper T 380A has a shelf life of 10 years. No issues with this. So here copper means the metal which is used. T means the shape of the IUCD. 380 is the, this was asked. 380 is the surface area of the metal used. Here the surface area of the copper used. So how much copper is used? It is 380 millimeters square. Okay, no issues with this. So please remember, what does 380 signify? 380 signifies the surface area of copper. 380 signifies the surface area of copper. A, B or C, whatever it is, it signifies the length of the vertical limb. It signifies the length of this vertical limb. No issues with this. And this thread is used for removal of IUCD. The thread is used for removal of IUCD. LNG it is. LTA ka dikha. Then next, if I talk about this one, the third generation IUCDs which are there, okay, these are usually hormonal IUCDs. The third generation IUCDs are hormonal IUCDs. That means they are medicated with hormones, and they contain which hormone? Anybody? They contain progesterone. ठीक है? We have two types of hormonal IUCDs: Progestacert and Mirena. Progestacert and Mirena and Progestacert. ठीक है? No issues with this. The one which is shown is what? So this one which has a dip at the handle, okay, a dip at the handle, it is a Mirena. If there is a dip at the handle, it is known as the Mirena. If there is a dip at the surface, it is known as the Mirena. Okay, and they contain which hormone? Progesterone. So the content is different, but the release of progesterone would be similar, and the release rate of progesterone would be how much? So they would release progesterone at what rate? 65 micrograms per day. They will release progesterone at what rate? 65 micrograms per day. So hormonal IUCDs release progesterone at what rate? 65 micrograms per day. So these are all recall questions. Okay? At what rate progesterone is released from hormonal IUCDs? It is 65 micrograms per day. No issues with this. Now let me know the most common side effect of IUCD. Anybody? Most common side effect of IUCD is bleeding. Most common side effect of IUCD is bleeding. Whereas the most common side effect responsible for removal is pain. ठीक है? पहले तो तुम conservative management करोगे. If the patient is not relieved on conservative management, then you will remove the IUCD. No issues with this. And if a patient gets pregnant with IUCD in situ, then we will remove the IUCD. First step is to remove the IUCD. And second step, you will counsel the patient, and if she wishes to continue, you will continue the pregnancy, or you will do a medical termination of pregnancy. No issues with this, anybody? All of these are one-liners which came from contraception. Next, as we know with barrier methods, as there are high failure rates, so the barrier methods like condoms or vaginal sponge, they should be combined with spermicidal jelly. So spermicidal jelly should be used along with it. And the spermicidal jelly chemical which is present, it is known as non-oxynol 9. The spermicidal jelly chemical is known as spermicidal jelly chemical is spermicidal jelly chemical is spermicidal jelly chemical is non-oxynol 9. No issues with this. So what is gossipol then? Gossipol is a pill used by Shabash. It is a male pill. Okay, please remember gossipol is a male pill. Ye question tha. Gossipol is a male pill. Gossipol is a male pill and it is made up of Chinese cottonseed oil. Okay, it is made up of Chinese cottonseed oil. Best method of contraception overall? Best method of contraception is sterilization. Nothing better than that. And what is the Perl index of sterilization? Less than 0.1 per 100 women years. So what is the Perl index of sterilization? What is the Perl index of sterilization? Less than 0.1. What is the Perl index of sterilization? What is the Perl index of sterilization? Less than 0.1. No issues with this. What is the advice you will give post non-scalpel vasectomy? So I hope so. You know sterilization is of two types. In males it is non-scalpel vasectomy and females it is tubectomy. Okay? In males you perform a non-scalpel vasectomy. What is the advice which should be given? 3 months of barrier use. 3 months of barrier use. So the patient should use barrier methods, that is your condoms, for at least 3 months after the procedure. Why? Because the sperms would be present in the epididymis and that can cause failure of contraception. And therefore, how many months after non-scalpel vasectomy barrier should be used? They should be used for a period of 3 months to avoid any contraceptive failure. This was asked 2 times. Okay, no issues with this now. Then सबने अच्छे से पढ़ाई होगा. This is known as the Billings ovulation method, and this Billings ovulation method is a natural method of contraception. It is a natural method of contraception. So there are different natural methods of contraception: Billings method, calendar method, fertile period method. All of these are natural methods, but they have a highest Perl index, and their Perl index is around 60 per 100 women years. Okay, no issues with this. Therefore, they are not recommended. If they ask you which is the best which is the best natural method used for contraception, it is the symptothermic. It is the symptothermic method, which is a combination of calendar method and cervical mucus studies. It is a combination of calendar method plus cervical mucus studies. No issues with this. ये extra point है. And ये image आई थी December में. What is this image? This is a निश्चय kit. This is a निश्चय. ये औरत के चेहरा देख लो ध्यान से, ठीक है? So it is a निश्चय kit, and निश्चय kit is given for detection of pregnancy. So it is actually a urine pregnancy test kit. So it is a UPT kit. What is निश्चय given for? What is निश्चय given for? Urine pregnancy test के लिए we have which kit? निश्चय kit. निश्चय कर लो, ठीक है? Next one that you have over here, it is a white cross with a red dot. White cross with a red dot is suggest your Suraksha Clinic. It is the logo for Suraksha Clinic. And Suraksha Clinic was started under the program that is RCH program, Reproductive and Child Health Program. Under this program, Suraksha Clinics were started. And why they were started? Because one of the important components of RCH program was sexually transmitted infections or reproductive tract infections. To diagnose and to treat these STIs or RTIs, we have started this Suraksha Clinic. So the previous RTI or STI clinics were renamed as Suraksha Clinic. Previous RTI or STI clinics were renamed as Suraksha Clinics. So they provide sexual and reproductive health services. They provide reproductive and sexual health services. Okay, and they have different types of kits. Okay, and these kits contain different types of medicines which are used for syndromic management of the patient. Okay, at the PSC level itself, or maybe at the subcenter level even. Okay, So mostly these Suraksha clinics are established at the PSC or subcenter levels. Okay, at that level they are there. Okay, Suraksha clinics. So we have total how many STD kits? We have total 7 STD kits. The kit number 1 is gray in color. The kit number 1 is gray in color. The kit number 2 is green. Then it is WBR. The mnemonic for Reynolds phenomenon is the same over here also. White, blue, red. So third is white. Third is fourth is fifth is sixth is and seventh is black. ठीक है अचानक white कहाँ से आया ठीक है so if I talk about the gray kit is used for urethral or vaginal or cervical or anorectal discharge. तो cervical vaginal कुछ बोलते हैं. So urethral, cervical or anorectal discharge. Gray kit is used for urethral, cervical or anorectal discharge. What is the gray kit used for? Urethral, cervical, anorectal discharge के लिए यूज होता है. ठीक है. Then green kit is used for important. Green kit is used for vaginitis. Green kit is used for most common vaginitis is bacterial vaginosis. Most common vaginitis is bacterial vaginosis. So if they ask you question, ये इस पे आया था medicine का बस. So if they ask you what is there in the green kit, the drug which is present is secnidazole. The drug which is present is secnidazole, and the other antifungal drug is fluconazole. The other antifungal drug is. So which two drugs are present in green kit? First is and second is. So fluconazole would be used for treatment of vaginal candidiasis, and secnidazole is used for treatment of trichomoniasis या bacterial vaginosis. So secnidazole belongs to the same family of metronidazole. ठीक है. Next, white kit and blue kit are used for genital ulcers. These are used for genital ulcers. But which variety? Herpetic or non-herpetic? So these are used for non-herpetic. These are used for non-herpetic genital ulcers. Whereas red kit, red means khatra. So red kit is used for herpetic genital ulcers. Red kit is used for herpetic genital ulcer. And the drug which would be present is acyclovir. Drug of choice for herpes is. Therefore, the drug present in red kit is acyclovir. And red kit is used for treatment of herpetic genital ulcer. Then yellow kit is used for lower abdominal pain. Yellow kit is used for lower abdominal pain. Yellow kit is used for lower abdominal pain. And lower abdominal pain is the most common symptom of PID, pelvic inflammatory disease. So either they give you lower abdominal pain or features of pelvic inflammatory disease. The kit to be used is whereas black color kit is used for inguinal bubo. The black colored kit is used for scrotal swelling के लिए भी use. Kit 1 gray in color. Kit 1 that is used for scrotal swelling. ठीक है. तो images में कभी-कभी गड़बड़ हो सकती है, इसीलिए लिख लो. Kit number 7 that is black in color used for inguinal buboes, whereas scrotal swelling के लिए भी use kit number 1 that is gray in color. Now talking about this one. So don't confuse it with this logo, guys. It is a pure white cross. Okay. So if it is only a pure white cross, it is used for first aid. So pure white cross is the logo of white cross with red bindi. बिंदी से समझ जाओ. ठीक है. So you can remember like this. ठीक है. No issues with this. तो आसान है. गंगू भाई देखिए ना सबने, तो वही है. नहीं देखी तो ठीक है. जो next talking about health communication. ठीक है. So if I talk about health communication, guys, so there are two methods of health communication. Either it is a one-way method known as didactic method. One-way method known as didactic method. यही confusion है, इसीलिए याद कराता हूँ. One-way method known as didactic. Those के नाम में die है. It is a one-way method of communication. And the other two-way method is known as Socratic. Two-way method of communication known as. So one-way, two-way, Two ways Socratic. ठीक है? So if I talk about quiz खेलते जल्दी से. So you tell me either it is didactic or Socratic method. ठीक है? So if I talk about lecture, chalk and talk method, it is didactic. Lecture is a didactic. Lecture is a the lecturer will come, give you the lecture 15 to 20 minutes के लिए. Audience size would be less than 30 minutes. Audience size would be less than 30 persons, and it would be a period of 15 to 20 minute duration. No question and answers allowed. So it is only a one-way method of communication. Ours is not a lecture. So lecture or chalk and talk method is didactic. Lecture and chalk and talk method is didactic. Flannel graphs, one way again, didactic. Flannel graphs, when pictures are pasted on a cloth of a piece of cloth, that is flannel graph. ठीक है, अलग सा नाम है तो याद रख लो, flannel graph. It is didactic method of communication. TV, didactic. Radio, newspaper, books, didactic. Demonstration, Socratic. Demonstration is, so this is what you can see over here is a demonstration. This is what you can see over here is a demonstration. ठीक है? So in demonstration, क्या हो गया? ठीक है. So it is demonstration, and demonstration is used for preparation of ORS. Demonstration is used for preparation of. So here the healthcare worker is showing the mothers of the village how to prepare ORS for your child, right? For in cases of diarrhea or dehydration, when the child is given ORS, the mother should know to prepare ORS, and that is taught by which method of communication? So ORS preparation is taught by which method of communication? Demonstration. Image dekh lo, theek hai? Demonstration. And there are two fundas. First is seeing is believing. That means whatever you will see, you will believe in it. And second is learning by doing. Whatever you will do, you will learn it. Okay? So on these two fundas, demonstration is based. So demonstration is which method of communication? Socratic. It is which method of communication? Socratic. Then if I talk about focus group discussion, question last time, December. It is a Socratic method again. Focus group discussion is a Socratic or a two-way method of communication. It is a two-way method of communication. So if I talk about focus group discussion, the number of participants would be, number of participants are, this was the question in December. Number of participants in FGD are 6 to 12 participants are there, and all of them actively participate in the discussion. So it is a group discussion, focus group discussion. One of them is the leader who will initiate the talks, okay, and one of them is the recorder who will record कि इसके बाद कौन बोला, उसके बाद कौन बोला. And at the end of a focus group discussion, this diagram which is made, it is known as a sociogram. So a diagram made at the end of FGD is known as sociogram. Is seen in which method of communication? Focus group discussion. It is which method of communication? Didactic or Socratic? It is a Socratic method of communication, and the number of participants is 6 to 12. No issues with this. So it is a highly effective method of communication. But if I ask you about the best method of health communication, it is best method of health communication. It would be Shabash. It is interpersonal communication. It is interpersonal communication or one-on-one communication That means a doctor and a patient. So the best method of health communication is interpersonal communication. Best method of health communication is interpersonal communication or one-on-one communication. No issues with this. Then if I talk about malignancy, so to break out the news, like for example, a patient was diagnosed with some cancer, cervical cancer, lung cancer, and now you need to break out the news to the patient. Okay, this is done by which health communication technique? So to break out any bad news to the family or to the patient, it is done by a technique known as spikes technique. So to break out the rule of to break out the news of malignancy or adverse outcome, it is done by which technique? Whereas for contraception counseling, which technique or which approach was used? For contraception counseling, so this question has been asked, guys. For contraception counseling, which approach? And gather approach was previously known as cafeteria approach. Gather approach was previously known as cafeteria approach. All of these questions came. ठीक है, छोटा टॉपिक है बट क्वेश्चंस आते हैं. ठीक है, दिसंबर में ही प्रूव हुआ है 6 to 12 पीपल वो क्वेश्चन आया था. Easy, no issues with this anybody? So याद रखना. ठीक है. Anybody conferences or seminars or which method of communication? Socratic, didactic? Conferences and seminars are two-way. So Socratic method of communication. Workshops, again a two-way method of communication. Street play, nukkad drama, nukkad natak. Street play or nukkad natak, two-way method of communication. Why? Because after a street play usually, then there is a Q&A session. So please remember, street play or nukkad natak is an example of Socratic method of communication. And the ideal audience size for nukkad natak is, ideal audience size for street play is less than 25. Ideal audience size for nukkad natak is less than, ideal audience size for nukkad natak is less than 25. So nukkad natak, street play, role play, social drama, all of these are the names for the same thing. Okay? So you will see it in your PSC postings. You will perform any nukkad natak or street play in the front of a rural audience to explain them better about health. Okay? Awareness. Now starting with the important topic, and that is demography. So I hope all of you are quite aware with demography. First indicator that we'll study is the crude birth rate. Crude birth rate is total number of births upon total mid-year population into 1000. So it is a rate. A is a part of B and multiplier is 1000. So therefore CBR is a CDR ka formula, total number of deaths upon mid-year population into 1000. So therefore again crude death rate is also a rate and crude birth rate is also a rate because the multiplier is 1000 and the denominator is mid-year population. So what do we, this was a question in August. When do we calculate mid-year population? We calculate mid-year population on 1st of July. Mid-year population is calculated on 1st of July and it is also celebrated as National Doctors Day. Okay? Then if I talk about crude birth rate, according to the recent SRS 2022, what is the current value of crude birth rate in India? According to recent SRS, 19.7 per 1000 live births. Okay, what is the current, per 1000 mid-year population? So what is the current crude birth rate of India? 19.7 per 1000 mid-year population. No issues with this according to recent SRS. I am telling you. SRS March 2022. Check the values now in front of me. Okay, कोई दिक्कत नहीं है. Now, current CBR is 19.7. If they ask you census, then it was 20.2. ठीक है, तब आंसर करना. But if they ask you recent SRS, then the answer should be 19.7 per 1000 mid-year population. What is the current CBR? What is the current crude birth rate? 9. अरे CBR का crude birth rate कर दिया तो आंसर क्या? It is 19.7 and the current CDR previously it was 6.3 to 6.2. ठीक है, बाद में हुआ था. But now according to recent SRS March 2020, it is 6 per 1000 mid-year population. So the current crude death rate of India is 19.7 No issues with this anybody. Moving further, if I talk about total fertility rate, it is easy. Total fertility rate means total number of children born to a woman in her entire reproductive lifespan. Okay, so what is TFR or total fertility rate? Total number of children born to a woman in her entire reproductive lifespan. No issues with this. जितने भी बच्चे एक औरत को पैदा हुए, that is what? That is total fertility rate. No issues. The total fertility rate of India is currently 2.2. तो ये भी old data है, but ठीक है. Currently it is 2.2. and our target is to take it to less than 2.1. Our target is to take it to less than 2.1. So around it is 2.2 recent census ke according. Okay, no issues with this. Then if I talk about GRR, that is gross reproduction rate. GRR is gross reproduction rate. What do we mean by reproduction? That means how many girl children the patient, the woman is having. Okay, reproduction means how many girl children the woman is having. So gross reproduction rate is total number of girl children. What is gross reproduction rate? Total number of girl children born to a woman in her entire reproductive lifespan. What is gross reproduction rate? Total number of girl children born to a woman in her entire reproductive lifespan. What is NRR? Net reproduction rate. What is NRR? Net reproduction rate. And NRR is what? Total number of girl children. So I would say it like this. What is NRR? Total number of girl children born to a woman in her entire reproductive lifespan minus the mortality. So it would be easier like this. Gross reproduction rate minus mortality. Gross reproduction rate minus mortality. So gross reproduction rate is total number of girl children, but net reproduction rate is only alive girl children. Net reproduction rate is only alive girl children. You will minus the mortality or the dead girl children. Okay? So therefore, NRR is the best fertility indicator. So if they ask you which is the best fertility indicator, answer is best fertility indicator is, and why? Because we will consider mortality. Right? Then what is GFR? General fertility rate. GFR is general fertility rate. General fertility rate means total number of live births. Total number of live births upon total mid-year population of females between 15 to 49 years. Total mid-year population of females between 15 to 49 years. No issues with this? Yaad rakhna. And what do we mean by child-woman ratio then? Child-woman ratio is children between 0 to 4 years. Children between 0 to 4 years upon total mid-year population of females. Total mid-year population of females between 15 to 49 years. Between 15 to 49 years. No issues with this? Anybody? Any doubts? Okay. So general fertility rate is total live births upon total females between 15 to 49 years. And child-woman ratio is children between 0 to 4 years upon total number of females between 15 to 49 years. ये याद नहीं रह रहा तो कम से कम ऊपर वाले 4-5 याद रख लो. ठीक है? Till NRR you should be thorough with all of those 5. Next, last one is dependency ratio. Dependency ratio, naam mein hai, it is a ratio. Dependency is a ratio. That means numerator is not a part of the denominator. So numerator would be non-earning population, whereas denominator would be the earning population. So numerator would be population between less than 15 plus more than 65 years. Upon denominator would be 15 to 65 years. 15 to 65 years of age group. No issues with this. So yaad rakhna. What do we mean by dependency ratio? Jaldi se. Population less than 15 plus more than 65 upon 15 to 65. So easy language mein yaad rakho. Dependency ratio is equal to non-earning upon earning population. Non-earning upon. So dependency ratio is equal to non-earning upon earning population. No issues with this? Anybody? I hope so. Okay? And non-earning is less than 15-year-old child and more than 65-year-old elderly patient upon the earning population is 15 to 65-year-old individuals. No issues? I hope so. Okay? Then if I talk about this one, what is this? This is a demographic cycle. This is a demographic cycle. So this tells you about the population growth of a country. Okay? So here you can see there are two important parameters. This blue line will show you about the birth rate and the dotted line shows you the death rate. So these are the crude birth rate and crude death rate. Okay? So there are how many stages of demographic cycle? There are 5 stages. How many stages of demographic cycle? 5 stages. ठीक है? So first stage is the high stationary stage. First stage is the high stationary stage. So here the birth rate would be high, whereas the death rate would be high. No issues with this, and the population remains constant. Second is the early expanding stage. Second is the early expanding stage. So here, due to development of health facilities in a country, birth rate is still high, but the death rate starts declining. The death rate starts declining. No issues with this. Then stage 3 is the late expanding stage. Stage 3 is the late expanding stage. Here, death rate is already declining. Death rate is already declining, and birth rate also starts to decline. Birth rate also starts to decline, but the death rate is still more than birth rate. Okay, sorry, the death rate decline is still more than the birth rate decline. No issues with this. Fourth stage is the low stationary stage. Fourth stage is the low stationary stage. So here birth rate is also declining and death rate is also declining, and both are declining at the same rate, and therefore the population remains constant, and therefore it is known as the stationary stage. And last, fifth stage is the stage of decline. Fifth stage is the stage of decline. And in this fifth stage, the stage of decline, here the crude birth rate would be less than the crude death rate. Crude birth rate is less than the crude death rate. No issues with this, anybody? So if I ask you some important question, jaldi se pehle stages revise karte. Stage 1 is stage 1 is stage 1 is stage 2 is stage 2 is stage 3 is stage 3 is stage 4 is stage 4 is stage 5 is stage 5 is declining stage. Now the difference between the crude birth rate and the crude death rate, it is called as demographic gap. It is called as demographic gap, also termed as the growth rate, also termed as the growth rate, right? Difference between crude birth rate and crude death rate is called as the demographic gap or the growth rate of a country. Okay? So please let me know, minimum demographic gap is seen in which stages of demographic cycle? Minimum demographic gap is seen in stage 1 and stage 1 and stage, because both of these places the population is stationary. So minimum demographic gap is seen in negative demographic gap is seen in negative or inverse demographic gap is seen in stage 5. That is your declining stage. So negative or inverse demographic gap in stage 5 or the declining stage. Then maximum demographic gap is seen in late stage 2. Maximum demographic gap is seen in and India is currently in which stage of demographic cycle? India is currently in stage, also known as late expanding stage, No issues with this. I hope so. Demographic cycle theek hai sabki. Moving further, then if I talk about the different data collecting systems of the Indian population that we have, okay, the most important and the largest data collecting system of the Indian population is census. Census is conducted by the Ministry of Home Affairs, and it is conducted once every 10 years. The last census was conducted in 2011. Still 2021 is pending. ठीक है, याद रखना. The first क्या हुआ? Anyway, late expanding क्या? क्या हुआ? No. It is late stage 2, the demographic gap widens, and early stage 3, the demographic gap starts to contract. Okay? So if they ask you the demographic gap contraction starts at, then demographic gap contraction will start at early stage 3. यहाँ पे देख कुछ अलग रहा है, वैसे होता है वो. It is late stage 2, maximum demographic gap, and contraction starts at early stage 3. No issues with this. तो याद रखना, तो वो इमेज पे मत जाओ. Then first census was conducted in 1871. First census was conducted in. First census was conducted in. First census was conducted in. First disability census was conducted in. First disability census was conducted in. 4 वाला कौन था? 1881. First disability census was. First disability census was. First disability census was. First census was 1871. So the second census was the first disability census. ठीक है? Till now 15 census have been conducted. ठीक है? No issues with this. And in census, usually nowadays in the last census, more things were added. That is your unique identification number, and this unique identification number is known as Aadhaar. That is your Aadhaar. 10 fingerprints were collected. Iris scan was taken. Photographs were taken. So all of these were taken. And recently we have added NRC also, National Population Register of Citizens. Okay? No issues with this NRC. Then next, if I talk about this one, guys, over here, you can see that the Indian population, this is the graph of the Indian population. Indian population was just always increasing, except in 1 year where it showed a decline, and that was 1921 census. Okay, Indian population only shown a decline in which census? Indian population only shown decline in which census? Very good. So 1921 census, or the year of 1921, therefore is known as the year of. It is known as the year of. It is known as the year of Big or Great Indian Divide. It is known as the year of Big or Great Indian Divide. So which is the year of Big or Great Indian Divide? Year of Big or Great Indian Divide is? Year of Big or Great Indian Divide is? उसका भी कारण था, सुधर नहीं गए थे लोग. 1920 में there was a epidemic which occurred, plague. ठीक है? So that is the reason. So what is the reason? Which is the year of 1921? Sorry, which is the year of Big or Great Indian Divide? Which is the year of Big or Great Indian Divide? 1921. No issues with this. ठीक है. कोविड आके भी नहीं हुआ है 2021 में कुछ. Then if I talk about, उल्टा बढ़ा है लॉकडाउन का. According to census, the decadal growth rate was 7.64%, 17.64%, sorry, and the annual growth rate was 1.64%. Recent SRS shows it is to be 13.6%. Okay? Now talking about ratio. So in census, we also get to know about the ratio. That is your sex ratio. Sex ratio is number of females. अरे फॉर्मूला बता दो. Sex ratio is number of females into total number of males into 1000 into multiplier is, so number of females per 1000 males. Sex ratio is what? Number of females per 1000 males. What is sex ratio? Number of females per 1000 males. ऐसे याद रख लो तो easy हो जाएगा. Okay, sex ratio is what? Number of females per 1000 males. And the value of the sex ratio according to census, it was 943. That means we had 943 females per 1000 males. We had how many females? 943 females per 1000 males. Okay. Highest sex ratio is in the highest sex ratio is in the state of highest sex ratio is in the state of and lowest sex ratio is in the state of शाबाश. Highest sex ratio is in the state of, मैंने यूनियन टेरिटरी पूछा, क्वेश्चन ऐसे ही गलत कर दोगे. ठीक है? So please remember, so it is सेक्स रेशियो अभी बढ़ गया. अभी तो रिसेंट अकॉर्डिंग के हिसाब से 1024 तक पहुंच गए अपन. ठीक है? सो ठीक है, इन केरला द सेक्स रेशियो अकॉर्डिंग टू 2011 वाज 1084 females per 1000 males. ठीक है? That is a favorable sex ratio. And the lowest sex ratio was in the state of Haryana, but overall lowest it was in the union territory of Daman and Diu. It was lowest in the union territory of Daman and Diu. Only 648 females per 1000 males. That is a highly unfavorable sex ratio. ठीक है? याद रखना. No issues with this. So if they ask you lowest sex ratio, lowest Lowest sex ratio is in seen in lowest sex ratio in come on and do lowest sex ratio in lowest sex ratio in lowest sex ratio in which state? Lowest sex ratio in which state? मैं स्टेट बोलूं तो हरियाणा आंसर होगा. ठीक है. If I talk about child sex ratio, it is number of girl children. It is number of girl children between 0 to 6 years. Between 0 to 6 years upon number of boys between 0 to 6 years into 1000. And what is the sex ratio, child sex ratio according to census? 919. According to census 2011, it was 919. And highest child sex ratio is in the state of highest Uttar Pradesh. Highest sex ratio is in the state of highest child sex ratio is in the state of Mizoram. Highest child sex ratio is in the state of highest child sex ratio is in the state of and lowest child sex ratio it is in the state of lowest child sex ratio is in the state of okay due to female or infanticide or feticide. No issues with this. Then if I talk about literacy rate, guys, literacy rate is number of literates. Literacy rate is number of literates upon total media population, but more than 7 years, more than equal to 7 years into 100. So the multiplier in literacy rate is and A is a part of B. Therefore, it will be expressed in percentage, and therefore it is a proportion. So literacy rate is a no issues with this. According to census 2011, the literacy rate of India was 74%. Literacy rate of India was 74%. That means 2/3 of the Indian population was literate. Literate means the person is able to read, write, and comprehend in any one of the Indian language. Okay, that is what is a literate. Okay, so 74% was the literacy rate of India. Okay, 82% in males and 64% in females, 65% around. No issues with this. Highest literacy rate is in the state of Kerala and lowest literacy rate is in the state of Bihar. No issues with this. हंसने की क्या जरूरत है, हाथ लोगों तुम. Now जल्दी से एक बार रिवाइज करते हैं. Current sex ratio according to census 2011. Child sex ratio, child sex ratio, literacy rate, highest literacy rate, lowest literacy rate, highest child sex ratio, lowest child sex ratio, highest sex ratio, lowest sex ratio in which state? No issues with this. Multiplier for sex ratio and child sex ratio is and for literacy rate multiplier is and therefore literacy rate is a shabash. Most accurate data collecting system of India, if I ask you, it is sample registration survey. Most accurate data collecting system of India is SRS, sample registration survey, because it is conducted once every 6 months. It is conducted by the Ministry of Home Affairs. And important question from June, December 2020, which are all the parameters which are studied under maternal mortality ratio, under the sample registration survey. And there was a case, okay, my junior actually had a case on this. Okay, so it was given that IMR, CBR, CDR, and MMR. So which is not included in the SRS. So according to Census Commissioner, he himself gave a written explanation that MMR, NB को मुंह की खानी पड़ी थी वहां पे. Census Commissioner himself gave a written explanation that MMR is also included in sample registration survey. So question गलत था और 1 मार्क्स ज्यादा मिला था दिसंबर वालों को 2020. ठीक है. So please remember, so all the parameters which are studied in sample registration survey are infant mortality rate, maternal mortality ratio, crude birth rate, crude death rate, and growth rate. No issues with this, anybody? Now, ठीक है सब कुछ. So all of these parameters are studied under the sample registration survey. ठीक है. So पहले NB वाले मान नहीं रहे थे, but when census commissioner himself gave a written ये कि हम करते हैं MMRV calculate, ठीक है, that is the thing. और MMR recent SRSC ही आया है 103, right? So if I talk about under 5 mortality rate, currently it is 34 यार, क्योंकि उसके बाद कोई वैल्यू नहीं आ रही है, ना कोई क्लियर इंडिकेशन है गवर्नमेंट की तरफ से भी. 39 था पहले, now it is 34, ठीक है. Now vital registration system, ठीक है सब. It comes under the municipal corporation in the district, ठीक है, or in the city, and the registration of birth and death should be done within a period of birth and death should be registered within a period of birth and death should be registered within a period of marriage can be registered within a period of marriage can be registered within a period of even in period of 90 days, ठीक है. हनीमून पे चले गए, भूल गए तो चलो बफर टाइम दिया उनको, ठीक है. So 30 days minimum, maximum it can be 90 days, not beyond 90 days, ठीक है, याद रखना. If a child was born to an NRI couple abroad, so the birth registration should be done within 60 days of arrival. 60 days of arrival. No issues with this, anybody? I hope vital registration service subpart. Then there is also a National Family Health Survey conducted by Ministry of Health and Family Welfare and a district level household survey. Okay, 4 of them are conducted. 4 NLHS and 4 DLHS are conducted till now. Then if I talk about this, what are these? These are population pyramid. These are population. So population pyramid help us differentiate between a developing and a developed country. So a developing country will have which shape? Triangular shape. Developing country will have a so developing country like India will have this shape, whereas developed country like USA will have a spindle shape. Developed country like USA will have a spindle shape. Important. Okay. So if you can also study the sex distribution, on left side we have males, right side we have females. Okay. So if there is a asymmetrical distribution, it is suggestive of a developing country. Asymmetrical distribution is seen in whereas symmetrical distribution of males and females is seen in life expectancy is given by the height of the pyramid. If height of the pyramid is high, it is a developed country. If height of the pyramid is high, it is a if height of the pyramid is low, it is a Now, developing country will have a broad base and a narrow apex. Why? Because we have more population who are children. ज़्यादा population बढ़ रही है ना अपनी. And developed countries have less children and they have more working population. Therefore, there would be a bulge in between. No issues with this. That is how the shapes come. So, जल्दी से shapes की बात करें. Spindle shape for triangle shape for more height for less height for symmetrical distribution for asymmetrical distribution for broad base, narrow apex, bulge in the middle. No issues with this, anybody? Moving further with nutrition now. ठीक है, मैं exactly 5:10 को break दूंगा. ठीक है, कोई दिक्कत उसमें? No issues. नहीं 5:10 कहा, सॉरी 5:40 को ब्रेक दूंगा. 3:30 को स्टार्ट किया ना, मैंने भूल गया था. न्यूट्रिशन, इफ आई टॉक अबाउट न्यूट्रिशन एंड हेल्थ. नाउ इफ आई टॉक अबाउट द वैल्यूज, द रीसेंट वैल्यूज व्हिच आर चेंज. ठीक है, इतना इंपॉर्टेंट है नहीं, बट ठीक है, अगर गलती से पूछ लिया खुदा ना खास्ता तो याद रखो. व्हाट इज द कैलोरिक, व्हाट शुड बी अ कैलोरिक इनटेक फॉर अ अडल्ट मैन having a sedentary lifestyle? So it is 2110 kilocalories. It is 2110 kilocalories. For moderate lifestyle, it should be 2710 kilocalories. 2710 kilocalories. For heavy lifestyle, it should be 3470 kilocalories. 3470 kilocalories. For adult woman who is having a sedentary lifestyle, it should be 1600 and now guidelines are 1660 kilocalories. For moderate lifestyle, it is 2130 kilocalories. 2130 kilocalories. And for heavy lifestyle, it is 2720 kilocalories. 2720 kilocalories. No issues with this. याद नहीं रहता है, ठीक है, छोड़ो, कोई दिक्कत नहीं, ठीक है. लर्न करना है थोड़ा या छोड़ दूं? लर्न कर लेना फिर, ठीक है. So these caloric intake is usually in kilocalories per day. This is in kilocalories per day. ठीक है, no issues with this. Now if I talk about this one, recommended dietary allowance. So recommended dietary allowance for these three are important, at least please remember. So recommended dietary allowance for adult man and woman. For calcium it is milligrams per day. It is very good. Bolo. Koi to bolo. It is 1000. Very good. It is 1000 milligrams per day. So the recommended dietary allowance for calcium is, recommended dietary allowance for adult man or woman is, recommended dietary allowance for calcium is, recommended dietary allowance for calcium is 1000. Whereas in pregnancy and lactation it becomes, whereas in lactation and pregnancy it becomes, in lactation and pregnancy it becomes 1200 milligrams per day. It becomes 1200 milligram per day. ठीक है, तो एक जैसा याद रख लो. वो प्रेगनेंसी में कुछ बुक्स बोलती है 1000, बट और प्रेगनेंसी एंड लैक्टेशन बोथ इट इज 1200 milligrams per day. If I talk about vitamin D, for adults it is 600 international units. For adults it is 600 international units. For pregnancy and lactation also it is, for pregnancy and lactation also it is 600 international units. Iodine intake in an adult man or woman is 150 क्या milligram या microgram? 150 micrograms per day. 150 micrograms per day. Whereas in pregnancy it is 250 and lactation it is 280. Lactation it is, जल्दी से, calcium RDA for adult man or woman. Calcium RDA for adult man or woman. Calcium RDA for pregnancy and lactation. Calcium RDA for pregnancy and lactation. Vitamin D in adult. Vitamin D in pregnancy and lactation. Vitamin D in infant. मैंने बोला था विटामिन डी ए थोड़ी दे रहे हो. 400 international units till 1 year of age. As I told you, according to our program, we give 400 international units of vitamin D till 1 year of age because human milk is deficient in vitamin D. Right? No issues with this. याद रखना. Iodine, adult man and woman. Adult man and woman. Pregnancy, lactation, unit, micrograms per day. It is a trace nutrient. ठीक है, तो micrograms में होगा. Now, please tell me best indicator of protein quality. मुझे लगा ही था, इसीलिए पूछा मैं. So now, net protein utilization and NPU में क्या difference है? So please remember, the best it is protein energy ratio. ठीक है, if this you have an option, it is the protein energy ratio. Followed by the next one is DIAS. Followed by the next one is DIAS. It is the best one used in health program is DIAS nowadays. Protein energy ratio is the overall best indicator. But the most common used is the DIAS. Digestible indispensable amino acid score. Followed by PDCAS. Followed by PDCAS, protein digestibility corrected amino acid score, and followed by your NPU, net protein utilization. ठीक है, तो वो चौथे नंबर पे आता है. So the best indicator for protein quality is protein energy ratio. What is the best indicator for protein quality? Best indicator for protein quality? Best indicator for protein quality? Followed by DIAS. Followed by DIAS. Followed by DIAS. DIAS followed by PDCAS, DIAS followed by and PDCAS followed by NPU. ठीक है, so the most common one used is actually DIAS nowadays, but previously we used to use NPU, net protein utilization. And highest NPU is seen when egg has the highest NPU of, therefore highest quality protein is, and therefore it is also known as reference protein of India. Therefore it is also known as, so which is the reference protein? NPU कितना है का? And highest quality of protein is seen in? If I ask you highest quantity of protein is seen in? Shabash. Highest quantity of protein is seen in? Highest quantity of protein is seen in? Soybean contains 43% of protein. Soybean contains 43% of protein, whereas egg only 6% of protein. Okay, 6 gram. No issues with this. Highest quantity is in soybean, but highest quality is in egg. Reference protein is? No issues with this, anybody? I hope so. Then if I talk about this macronutrients are proteins, fats, and carbohydrates. So for a balanced diet, how much percentage of protein should be there in your diet? 10 to 15%. How much percent of protein? How much percent of proteins? How much percent of fats? 15 to 30%. How much percent of fats? How much percent of fats? And how much percent of carbohydrates? 50 to 70. How much percent of carbohydrates? So a balanced diet should contain how much percent of proteins? How much percent of fats? And how much percent of carbs? 50 to 70. So now the energy derived per gram of these molecules. So per gram of protein, energy derived is 4.2 kilocalories. Okay. So from protein, per gram of protein gives? Per gram of protein gives? Per gram of protein gives? Per gram of fat gives? Per gram of fat gives? Per gram of fat gives? Per gram of carbohydrates gives? Per gram of carbohydrates gives? 4.1 kilocalories. If I talk about the importance, so importance में सबसे ऊपर कौन आता है? Protein, followed by fats, followed by carbohydrates. So these are given in the same sequence. ठीक है? So importance में the most important is proteins. Okay, no issues with this. Proteins give energy of 1 gram of proteins gives energy of 1 gram of proteins gives energy of 1 gram of fats gives energy of 1 gram of fats gives energy of 1 gram of carbs gives energy of 1 gram of carbs gives energy of 1 gram of alcohol gives energy of 7. 1 gram of alcohol gives energy of 7 kilocalories. No issues with this. याद रखना. Then what is this? Here you can see brown तो नहीं लग रहा मुझे. So it is a golden rice. This is a golden rice. It is a genetically modified crop. It is a genetically modified crop. And why golden rice was prepared? Because it is rich in and beta carotene. It is rich in iron and beta carotenes and so the genetically modified crop which is rich in iron and beta carotenes is golden rice. It is golden rice. No issues with this. Then if I ask you most essential amino acid, answer is Shabash. Amino acid बोला मैंने. Linoleic acid is a fatty acid. Most essential amino acid is leucine. Most essential amino acid is and leucine is present in maize. And therefore in maize there would be inhibition of conversion of tryptophan to niacin. So therefore maize eaters are at a higher risk of niacin deficiency, that is pellagra. Okay? And therefore leucine is also known as the pelagropgenic amino acid. Leucine is also known as the pelagropgenic amino acid. Leucine is also known as the pelagropgenic amino acid. Other essential amino acids are remembered by the mnemonic PV, Tim, Hall. jaldi se revise karte biochem. P for phenylalanine, V for valine, D for valine, T for threonine, T for tryptophan, second T for tryptophan, I for isoleucine, M for methionine, H for histidine, A for arginine, L for leucine, and second L for lysine. Shabash. Now all of these are essential amino acids. That means they have to be taken in diet. Okay, they are not prepared inside the body. Okay, they are taken inside the diet. Okay, then out of these two are semi-essential amino acids, and those are These are semi-essential amino acids. Semi-essential amino acids are histidine and arginine and histidine and arginine and are which type of amino acid? Semi-essential. That means they are not required generally in diet, but during increased demand. That means during puberty, lactation, pregnancy or infancy, we need to give this amino acids in the diet. Okay? During high demand phases, we need to give this amino acids. Okay? Histidine and arginine. No issues with this, anybody? Moving further. Now, this was a question which came. Maize ka aaya tha shayad in recent December. So, limiting amino acids. Mnemonic I have given you. Maize is deficient in 2 amino acids. There's a remembered as. So, the mnemonic is MLT. So, maize is deficient in lysine and tryptophan. Lysine and who is deficient in lysine and tryptophan? Which substance is deficient in lysine and tryptophan? यही भूल जाते हो नीचे. Cereals के लिए mnemonic है CLT. ठीक है? So cereals is deficient in, again L remains for lysine, L for and T for threonine. No issues with this, anybody? And pulses के लिए mnemonic is PCM. So P for pulses, C for M for methionine. No issues with this. Jaldi se. So deficient amino acid in maize are lysine and tryptophan and as tryptophan is deficient, so the patient will have pellagra because there would be decreased production of niacin. Okay, and the second reason for pellagra in maize eaters is usually presence of leucine, and leucine is a pellagrogenic amino acid. It stops the conversion. No issues with this. The amino acids deficient in cereals are lysine and threonine are deficient in cereal. ठीक है. Pulses are deficient in cysteine and methionine and they are deficient in डाले तुम्हारी. ठीक है. Then next, if I talk about richest source, jaldi se. So for fatty acids can be either saturated fatty acids or unsaturated fatty acids. Unsaturated fatty acids can be polyunsaturated or monounsaturated fatty acids. So the richest source of PUFA is followed by sunflower. Richest source of MUFA is monounsaturated fatty acid. Richest source of saturated fatty acid is. So coconut oil is harmful to health on a long term. ठीक है. Saturated अच्छा नहीं होता है. ठीक है. So saturated fatty acid का richest source है coconut oil. Iron का richest source of iron is dried pumpkin seeds. Richest source of iron is followed by pistachios. Followed by cashew nuts. ठीक है. विटामिन ए का richest source of vitamin A halibut fish liver oil. Richest source of vitamin A richest source of vitamin D richest source of vitamin D halibut fish liver oil. ठीक है. इसके बाद मैं वन लाइनर्स कुछ पूछता हूँ. Richest source of vitamin C amla, also known as Indian gooseberry. Richest source of vitamin C Indian gooseberry, that is amla. ठीक है. So now one liner. जल्दी से पहले ये कवर करते हैं, then I'll ask you one liner. Richest source of PUFA. Richest source of linoleic acid. So the most essential fatty acid is and it is a polyunsaturated fatty acid. So the richest source of linoleic acid would also be richest source of linoleic acid is also. No issues with this. So jaldi se. Richest source of PUFA, richest source of linoleic acid, richest source of arachidonic acid, richest source of MUFA, Richest source of saturated fatty acid? Richest source of iron? Richest source of iron? Richest source of vitamin A? Richest source of vitamin D? Richest source of vitamin C? Indian gooseberry or amla. Now one liner. Jaldi se answer karo. Now, richest non-citrus source of vitamin C? Guava. Shabash. Richest non-citrus source of vitamin C is? Richest non-citrus source of vitamin C is? Guava. Okay. If I ask you richest vegetable source of vitamin C? Cabbage. Richest vegetable source of vitamin C is? Cabbage. Okay. No issues with this. Now, if I ask you, and it is also present in all other citrus fruits like lemon, lime, santra, all of that, orange. Okay. Then if I ask you, richest vegetable source of vitamin A? Carrot. Richest vegetable source of vitamin A? Richest vegetable source of vitamin A? Carrot. Richest fruit source of vitamin A? Ripe mango. Richest fruit source of vitamin A? Ripe mango. Paka hua aam. Richest vegetable source of vitamin D? No plant source. Richest vegetable source of vitamin D? It has no plant source. So vitamin D का कोई fruit source, कोई vegetable source, कोई plant source नहीं होता. Vitamin D is only obtained by halibut fish liver oil, followed by sunlight. Therefore, in strict vegetarians or strict vegans, there would be deficiency of which two vitamin? Vitamin. One answer should be vitamin. One answer should be vitamin. Vitamin B12, because vitamin D can be synthesized by sunlight, followed by vitamin D. If you need to answer two, so mark it as vitamin B12 followed by vitamin D. No issues with this. याद रखना, ठीक है? Moving further. Now, if I talk about vitamin A deficiency. So vitamin A deficiency is known as xerophthalmia, where there would be dryness of the eye, further which will progress to blindness. The most common age group affected is children. Rather, it is the most common cause of preventable or blindness in children. It is the most common cause of preventable blindness in children. This was a question. Most common cause of blindness in children is vitamin A deficiency. If they ask you most common cause of preventable blindness, again the answer would be vitamin A deficiency. No issues with this. Overall, most common cause of blindness is cataract. Shabash. So if there is xerophthalmia due to vitamin A deficiency, anybody, which is the most common symptom? Most common symptom is night blindness, also known as nyctalopia. So most common symptom of vitamin A deficiency, most common sign is conjunctival dryness or conjunctival. Most common symptom is the one which patient will complain of, and sign is the one which doctor will identify. Okay? No issues with this, anybody? If I ask you which is the most characteristic or the most pathognomic feature, those are these toothpaste like spots on the sclera known as the Bitot spots. So most characteristic feature is according to WHO classification, Bitot spots fall under X1. Bitot spots fall under X1. X1A is X2 is corneal xerosis. X3A is corneal ulceration. X3B is keratomalacia. XN is night blindness. XF is xerophthalmic fundus, dry fundus, and XS is xerophthalmic sign. Very good. Okay? No issues with this. And if a patient is deficient in vitamin A, we will give vitamin A solution. Child less than 1 year, doses 1 lakh international unit. Child more than 1 year, doses 2 lakh international unit. Okay? Then, if I say a patient belongs to central parts of India, Madhya Pradesh, Chhattisgarh, okay? So in these states, usually there is high incidence of fluorosis. So fluorosis is when there is excess amount of fluorine intake, and the most common source of fluorine is drinking water. Most common source of fluorine is drinking water. And what is the recommended level of fluorine in drinking water? 0.5 to 0.8 what? Milligram per liter, also known as parts per mole. So the recommended level of fluorine, important hai. Recommended level of fluorine in drinking water is 0.5 to 0.8. When the fluorine level will exceed more than 1.5, when the fluorine level will exceed more than 1.5, it will cause dental fluorosis. When the fluorine levels will be between 3 to 6, it will cause skeletal fluorosis. When the fluorine level would be between 3 to 6, it will lead to skeletal fluorosis. And when the fluorine level is beyond 10 ppm, it will cause crippling fluorosis. When the fluorine level is beyond 10 ppm, it will cause crippling fluorosis. Crippling matlab paralysis ho jayega patient. No issues with this. More than 10, it would cause crippling fluorosis. More than 10, it will cause 3 to 6, 3 to 6 skeletal fluorosis. ठीक है, skeletal, ठीक है, देख लो. And more than 1.5, recommended level 0.5 to 0.8. No issues with this. If fluorine is less than 0.5, then that can cause dental caries. So fluorine कम भी बुरा है, ज़्यादा भी बुरा है. ठीक है? So it is a double-edged sword. No issues with this. Important. Now, important. If a drinking water has high amount of fluorine, that is in central parts of India, the technique used for defluoridation is question was there. The technique used for defluoridation is Nalgonda technique. Technique used for defluoridation is Nalgonda technique. And this Nalgonda technique was given by Niri Nagpur. It was given by Niri Nagpur. No issues with this, anybody? Nalgonda technique. Then if I ask you about this Nalgonda technique mein what is added? Lab is added. What is added? Lab is added. In which sequence it is added? Lime, alum, bleaching powder. In which sequence it is added? Lime, alum, bleaching powder. No issues with this, anybody? कोई दिक्कत है? So sequence important है. Lime, alum, bleaching powder. Lab is the mnemonic. ठीक है? Then a patient from Tamil Nadu presents to you with muscle weakness, tingling sensation, tachycardia and confusion. Vitamin deficiency would be, so Tamil Nadu, so the patients are more likely endemic to which disease? Vitamin B1 deficiency, that is thiamine deficiency. To which deficiency? Vitamin B1 deficiency, also known as thiamine deficiency. Yes, that will cause beriberi. Okay, and why people from south are actually deficient in vitamin B1? Because those are polished rice eaters, whereas thiamine is found in the rice coverings usually. Okay, so therefore polished rice eaters would be at a risk of will be at a deficiency of vitamin B1 deficiency. So in polished rice eaters, vitamin B1 deficiency, whereas in chronic alcoholics, if there is vitamin B1 deficiency, that will cause Korsakoff syndrome. Shabash. So vitamin B1 is known as vitamin B1 is deficiency of vitamin B1 will cause vitamin B1 deficiency causes head or dry beriberi, and vitamin B1 deficiency in alcoholics causes Wernicke-Korsakoff syndrome. Vitamin B1 deficiency in alcoholics causes Wernicke-Korsakoff syndrome. Vitamin B1 deficiency in alcoholics causes Wernicke-Korsakoff syndrome. And it is remembered, Wernicke's encephalopathy is remembered by the mnemonic GOA. And Korsakoff syndrome is characterized by the confabulation. ठीक है, अब मैं नहीं जा रहा इतना. Vitamin B2 deficiency, vitamin B2 is riboflavin, and deficiency of vitamin B2 will cause ariboflavinosis. Deficiency of vitamin B2 causes ariboflavinosis. And there are three important characteristic features. So there would be inflammation of lip known as chelosis. Inflammation of lips known as chelosis. Inflammation of tongue. Yeah, color badal dete. Just a minute, I'll change the color, guys. थोड़ा सा बदल रहा हूँ रुक जा. ठीक है. So inflammation of lips known as chelosis. Inflammation of lips known as chelosis. Inflammation of tongue known as glossitis. And this glossitis has a characteristic appearance. Therefore, it is known as geographic tongue. Therefore, it is known as geographic tongue. And inflammation of angles of mouth known as angular stomatitis. Angular stomatitis. No issues with this. So the triad of B2 deficiency. Jaldi se. Inflammation of lips, inflammation of tongue, glossitis characteristic name, inflammation of angles of mouth. ठीक है. ये तीन चीजें are seen in vitamin B2 deficiency. These are seen in vitamin B2 deficiency. And what is the most characteristic feature of vitamin B2 deficiency? It is angular stomatitis. It is angular stomatitis. ठीक है. So the most characteristic feature is then vitamin B3 is known as niacin, and niacin deficiency causes so pellagra is characterized by 3 Ds. Jaldi. First is diarrhea. First is ओके. शांति आ गई. कलेजे को ठंडक. ठीक है. First D for diarrhea. First D for diarrhea. Second D for dermatitis. Second D for dermatitis. So under this dermatitis seen in pellagra has a characteristic. This is known as the Cazal's necklace. This is known as the Cazal's necklace. Third D for dementia. Fourth D for death. Fourth D for fifth D for delirium. Fifth D for delirium. And sixth D for depression. Sixth D for depression. Depression. याद रखना. Depression है. Death fourth था. Then no issues with this. Moving further, vitamin B5 is known as pantothenic acid. Vitamin B5 is known as pantothenic acid. And deficiency of vitamin B5 will lead to burning foot or burning sole syndrome. Burning foot or burning. So vitamin B5 deficiency causes pantothenic acid deficiency causes burning foot or sole syndrome is caused by vitamin B6 is known as pyridoxine, and deficiency of pyridoxine can lead to which type of anemia? Microcytic hypochromic anemia. Which type of anemia? Microcytic hypochromic anemia. And peripheral neuropathy. It is due to intake of which ATT drug? Isonazid. Isonazid causes pyridoxine deficiency. Which drug causes pyridoxine deficiency? Vitamin B9 is known as folic acid. Vitamin B9 is known as deficiency of folic acid can cause megaloblastic anemia. Deficiency of folate causes in pregnancy deficiency of folic acid neural tube defects. It causes neural tube defects. Vitamin B12 is known as cobalamin. Okay, vitamin B12 is known as cobalamin, and deficiency of vitamin B12 causes megaloblastic anemia. Isolated will cause pernicious anemia. It will also cause peripheral neuropathy. And lastly, it will on long term can cause subacute combined degeneration of spinal cord. ठीक है. No issues with this. इसके बाद मैं क्विज देने वाला जल्दी से. ठीक है. Vitamin C is known as ascorbic acid. Vitamin C is known as ascorbic acid, and deficiency of vitamin C causes scurvy. Deficiency of vitamin C causes in scurvy there would be gum bleeding. Along with that there would be delayed wound repair. There would be a delayed wound repair and recurrent fractures. No issues with this. Moving further, vitamin D is known as cholecalciferol. Vitamin D is known as cholecalciferol. Deficiency of vitamin D causes, in children it causes, adults it causes osteomalacia, adults it causes osteomalacia, even osteoporosis. Selenium deficiency causes Cushing's disease. Selenium deficiency causes, and Cushing's disease is endemic cardiomyopathy. Cushing's disease is endemic cardiomyopathy. Zinc deficiency causes acrodermatitis enteropathica. Zinc deficiency causes acrodermatitis enteropathica. And here you can see there would be dermatitis around the mouth or around the inguinal region. Okay? So this is what is acrodermatitis enteropathica. It is due to deficiency of zinc. Okay? No issues with this. Then chromium deficiency causes impaired glucose tolerance. Okay? So all of you, जो भी online है, all of you also participate, please. Okay? So jaldi se I will ask you to tell me the vitamin. Okay? No issues with this. Angular stomatitis, chelosis, glossitis, geographic tongue, beriberi, Wernicke-Korsakoff syndrome, scurvy, rickets, osteomalacia, osteoporosis, megaloblastic anemia, B12, B99, pernicious anemia, microcytic hypochromic anemia, neural tube defects, peripheral neuropathy, 6 and 12 and subacute combined degeneration of spinal cord, pellagra, endemic cardiomyopathy, Cushing's disease, acrodermatitis enteropathica, IgT, impaired glucose tolerance, scurvy, burning foot and burning soul syndrome. Which vitamin will increase the absorption of iron? Shabash. Decreased by phytate and tannin. Shabash. आगे adulteration diseases, guys. After this, I will give you a break. ठीक है? So जल्दी से ये इतना ही है शायद nutrition. So for after nutrition, we'll take a break. ठीक है? So जल्दी से adulteration diseases. The disease is lathyrism. Toxin is beta oxalyl amino alanine. And the adulterant is C3 dal. Epidemic dropsy, the toxin is slanginerine. And the adulterant is argemon oil. Adulterant is endemic ascites. The toxins are pyrrolizidins. Endemic ascites, the toxins are and adulterant is protolaria. The adulterant is protolaria plant. ठीक है? Ergotism, adulterants are ergot toxins. Ergotism, the adulterants are and ergot toxins are usually due to infested grains which are infected with fungus, and the fungus from which ergot is derived is Claviceps purpura. From which fungus is ergot toxin derived? From which fungus is actually Claviceps purpura or Claviceps fusiform? ठीक है, दोनों भी हो सकता है. So from which fungus ergot toxins are derived? Aflatoxinosis is due to aflatoxins, and they are derived from the fungus. Aspergillus gravis. No issues with this. And usually aflatoxicosis is seen in which industry workers? Groundnut industry workers. No issues with this. Anybody? So jaldi se. Toxin for lathyrism. Adulterant for lathyrism. Endemic ascites toxin is and adulterant is Crotalaria plant. Ergotism, the toxin is derived from which fungus? Aflatoxinosis, the toxin is derived from due to infected epidemic dropsy, the toxin is, and the adulterant is lathyrism. Please remember, guys, it can be either osteolathyrism or neurolathyrism. Most common type is neurolathyrism. Most common type is neurolathyrism. And this image you can see osteolathyrism. In this you can see skeletal or osteolathyrism. So this is the image of osteo or skeletal lathyrism. So then if I talk about the Food Safety and Standards Authority of India, now everything comes under FSSAI. Okay? So every food standard would be taken care of by the, this is the image, just remember this. Okay? Then if I talk about this one, this is a ag mark. This is a ag mark. And ag mark works as a standard for ag mark works as a standard for agricultural products. Then this is ISI. Okay? So ISI works as a standard for industrial products. ISI works as a standard for industrial products. No issues with this. And now ISI and everything is under this, that is Bureau of Indian Standards. Bureau of Indian Standards. Okay? Every other standard authority comes under BIS, and BIS comes under FSSAI. Okay? For food, it is FSSAI. For all other standards, it is BIS. The main is BIS. For foods, it is. For foods, it is. For foods, it is. All other standards, it is. For all other standards, it is. For gold, metal, anything, it is BIS. And ये आया था अगस्त के एग्जाम में. ठीक है? मानकः पथ प्रदर्शकः. ठीक है? So BIS, Bureau of Indian Standards. No issues with this. Take a break. 5:30 हो गए. I will start the class sharp at 5:40. I have lot to cover, guys. इसीलिए मैं ज़्यादा breaks नहीं दे सकता. Sorry for that, but I need to cover everything today itself. ठीक है? बहुत है. We need to increase the speed as well.